Tracy Tyson. I'm a pediatrician in Vermont, and I wanted to talk about what is in my family's at-home medicine cabinet for children. I get this question a lot from families, and I think it makes sense to think about what do we use in our own families. I'm a big fan of fever reducers when needed, so we certainly have Tylenol or acetaminophen and ibuprofen. They can be used for different reasons, depending on the level of fever, if there's pain, what else is going on. Children under 6 months of age should be treated only with Tylenol. Over 6 months of age, I feel like ibuprofen works a little bit better for pain. It's also, we get rid of it in our body through the kidneys, so it's a little bit safer if you're needing to give it on a regular basis, as long as the child has something in their stomach. So I usually keep both of those. If one of my children had a fever when they were younger, they were miserable, and it was really affecting how they felt, or if it was over 102, I certainly treated it with Tylenol or ibuprofen. If the fever was under that level, it wasn't bothering them that bad, I would try to get it to go down just with taking a bath, cool drinks, allowing them to let the fever go down on its own. It really just depended on the situation, the age of the child, and how they felt. I used to keep Benadryl in my medicine cabinet for my children, but there have been some studies recently that showed that there might be some long-term complications using. So right now our recommendation is we really just don't recommend it in children. Those are called first generation, and right now we're recommending second generation antihistamines, something like Claritin or Zyrtec or Allegra, which work just as well for the acute runny nose or allergic reaction, rashes, itching, without the potential for long-term side effects. They're still looking into it, but as soon as the studies that came out that said there could be a problem, everybody just said, hold up, let's wait a minute. Right at this point in time, I don't have Benadryl in my medicine cabinet. So Zyrtec is the one that my family uses the most, just because that's the one that I feel like for us works the best, but I recommend any of these second generation antihistamines as well. I think it's always helpful to have some form of nasal saline. Most colds are really difficult for children because their nasal passages get so swollen. They really like to breathe through their nose. They can't breathe very well. They're miserable. A lot of times I'll get calls where families or children are having difficulty breathing when really what's happening is that the child is so congested they can't get air in and out. They're just miserable. They can't feed very well. They can't sleep. So nasal saline pulls water out of the tissues, thins out the mucus, gets it to come out a little bit, and then decreases the swelling so that when the mucus does come out, they can breathe a little bit better. It works very well. As long as you don't over suction it, you really can't overuse it in children. I don't recommend a lot of other cough and cold medicines over the age of 6. You can use over-the-counter cough and cold preparations, but it really just depends on the child and what's going on. So we still say, talk to your doctor, but I do keep over-the-counter cough and cold preparation now that my children are over the age of 12. And if they have a really bad cough or congestion and normal things are not working, certainly they can use those. I think it's always helpful to keep a topical over-the-counter hydrocortisone for bug bites and itchy rashes. That can be something that you can put on right away, as well as something with like a cool compress, which can really help if the child were to get a bug bite or some kind of itchy rash. I also think it's helpful to keep something for sunburn. So aloe vera is something that I used to keep, especially when I was in Florida. That was a little bit more common to happen. Although wear your sunscreen, a lot less likely to get. So that's really all that I keep in my cabinet. Probably being a pediatrician, I probably have Zofran or ondansetron, an anti-nausea medicine, which might not just be kept in everyone's cabinet, but I do have that in case one of my children is vomiting. But I still recommend talking to your pediatrician prior to giving it to your child, because you need to look for other things before you give it. But we like to keep it pretty basic. You don't need a ton. I do like to have a really great thermometer under the age of 2. All children's temperature should really be taken rectally. I'm not a huge fan of the really fancy dancy thermometers. I've seen some neat ones that have apps and things like that. I really want to like them, but I just find so often they're not correct. An old school oral thermometer, if you need to put it under the arm in a child who can't hold it in there, you can start with that. Ear thermometers are a little bit better than the forehead or temporal ones, but again, needs to be over the age of 2. If your child is under the age of 2, it really should be taken rectally. It's the only way to get an accurate temperature. To be honest, a lot of pediatricians, their child seems to have a fever over the age of 2. They give them Tylenol or ibuprofen or a cool bath. They don't even always check the level. So sometimes it's not even always important to know exactly what the temperature is. But I hope this helps. I think we should keep it simple. So often things will get better on their own and just need lots of rest and hydration, just supportive care. So take care.